And good evening, and welcome to this episode of the Your Health is Important Facebook Live broadcast brought to you by Lipodrops. I am Dr. MJ Collier, host, producer, and on-air personality, and we are here to answer your healthcare questions. We appreciate the fact that you have joined us tonight, and we look forward to answering each and every question that you may have. As you know, we start off with a little monologue, and I'm going to tell you what my topic is today. Thank you for being here. All right, our topic today is human sexuality, basically sexuality after the age of 50. And we have talked about this and teased it for a minute. We'll start off with the men. This is going to be a series, so we're going to start off talking about the men. Now, we know that the drug class, the PDE5 inhibitors, have changed the sex life of so many different people. And when I say the PDE5 inhibitors, I mean the Viagra, the Cialis. These are the two most popular, the ones that most people know the name of. There are others that can be utilized as well, but those are the big two. The differences being, men, if you have not tried the little blue pill, it's no longer little and blue. It is also no longer as expensive. When the branded product was still out, Viagra tablets were selling for $60 per tablet. That's a very expensive episode. If you got 10 tablets, that was $600. Now you can find them in most places for under $5, the average price being about $3 per pill. Much more reasonable. The generic version called sildenafil is the product that you want to see. So when you have that sildenafil, it comes in 50 milligram doses and 100 milligram doses. The thing about sildenafil or Viagra is this. It is very, very food sensitive. It is also sensitive to alcohol. And since most episodes of intimacy are precluded by a fine dining experience, ergo you go out to dinner and then you come back to your place or her place or home if you're married to engage in pleasure. And if you have eaten and then you take your pill and then you're ready for action and nothing happens. This now, let's say you had dinner at 8 o'clock. You're home now, it's 10:30, 11. You take the pill, you're waiting, she's getting frustrated, nothing's happening. The more you think about it, the more you worry about it, the more self-fulfilling the prophecy becomes, so nothing going on. You go to sleep, 3 hours later, you wake up, boom, everything is good. You're ready to go. But now your partner is asleep and not looking forward to you nudging her with your elbow at 2 o'clock in the morning or 3 o'clock in the morning, ready for action. So the simple problem is not a treatment failure from the medication. The problem is that the absorption of sildenafil Viagra is slowed tremendously by food and alcohol. So if you've had a couple of cocktails and then you had a full meal, including appetizers and desserts, then it's going to be hours before it's absorbed. How do you fix that problem, Dr. Collier? Well, the product lasts anywhere from 8 to 12 hours. So you can take it at 5 o'clock on your way home. You can take it at 6 o'clock on your way to the restaurant. You can take it before you eat. And if it's at least 15 minutes before you put anything else in your stomach, it will be absorbed. It will be out of your stomach and into your system, and it will be waiting for you. I have to explain to my male patients that you do not take a Viagra tablet and all of a sudden your pants are poking. You do not get a spontaneous erection. You have to be stimulated. But it is there waiting to stimulate you, waiting to receive stimulation. So if you plan your evening appropriately, if you know that it's going to happen, you say, okay, tonight is date night. We're going to definitely get together, because particularly when the price was $60 a pill, you did not want to take a pill and waste it and find out later that nothing's going to happen. That was a frustrating evening for all involved. So now, even with the price down to $3, you don't want to waste taking a pill. So you have to basically be in a frame of mind that you know that this is going to happen. So you can take the pill before you depart for dinner, before you have dinner at home. It will be out of your stomach and into your system within 15 minutes, and it'll be waiting for you when it's time for action. Now, that's the Viagra. The effect of Viagra will last up to about 12 hours. But if you take it later in the evening and you go to sleep, your metabolism slows down, ergo, the metabolism of the medication slows down. So it will still be there in the morning when you wake up, and round two is a distinct possibility if you have a willing and engaging partner. Now, the other issue or the other option is Cialis. Cialis, the weekend wonder. The effects of Cialis will last up to 3 days. So if you take the pill on Friday, you are good for the weekend. The price of the Cialis is again has come down. The generic name is called Tadalafil. Tadalafil. It comes in 10 milligrams and 20 milligrams. It also has a 5 milligram daily dose that some men take because it's very good for prostatic hypertrophy as well. So it helps shrink the prostate and helps you able to urinate easily. But the side benefit of that is that you take it every day, so you're always ready with an easily obtainable and functional erection. So the Tadalafil, 5 milligrams, 10 milligrams intermittent dosing, 20 milligrams to be taken at least 30 minutes before intercourse. And again, the effect will last up to 3 days. Well, some people say, well, suppose I want to take another one. You can take one on Friday. You can take one on Saturday. You can take one on Sunday. But you won't need to. If it works, it's going to work for you, and it's going to last that long. Stacking up on it is not going to enhance the benefits. You're just going to run out of your pills more accurately. But understand this, men, because now you have an ability to function at a higher level than you had previously. You have to make sure that your partner is prepared for that. That means not just jumping on for the marathon. All day preparation, foreplay that lasts all day. You start off the morning saying sweet things and saying how you're looking forward to the evening. You start off during the daytime with phone calls and text messages saying, how much you're going to enjoy yourself and how much you're looking forward to being with your partner that evening, for a romantic evening. If your partner is not as prepared, it's very important that you use a lubricant, because a sexual marathon sounds like a good idea, but for a woman, it ultimately results in being very sore and painful even during the act when it's prolonged, because the vagina can become dry if it's not stimulating enough. So again, no oil-based stimulants, no petroleum-based stimulants, no Vaseline in the vagina, but aqueous-based lubricants are very good, and saliva is also a very good lubricant and works wonderfully. And so you can use that. You just have to make sure that you stimulate your partner and that they are aware that this is going to be a little longer and maybe around 2 and around 3 compared to your previous episode, which either, was 2 minutes of hard work and that was that, or, you weren't able to function longer, or you had premature ejaculation. So these products, they don't stop you necessarily from prematurely ejaculating, but if you do ejaculate, you're not going to lose your erection, man. So it's better. So you're okay. If that happens, you're still able to function. Now, so people say, well, those products are good and they're okay, but what are my other options? There's something more natural I can take. Well, yes, there is. We finally are happy to announce that starting today, the Lipo T is available. Lipo T, the magic pill, the magic pill, the magic pill. This is what the bottle looks like. It comes in a red bottle, Lipo T, as you can see. Lipo T. This is an absolutely amazing product that will change your life, men, because you take this every day. It comes in a bottle of 90 tablets. The instructions state that you can take 2 capsules or 3 capsules every day, depending upon your level of function and how well you want to function. But I tell most people 2 capsules a day will probably do it for you. So if you take 2 capsules a day, the product will last you for 6 weeks. And if you get multiple bottles, then it's multiple times. If you take it 3 times per day or 3 capsules per day, then it's only going to last for 1 month. But you take it every day, you develop a level of sexual physical fitness that you did not have, and you're able to function in a very good and extraordinary manner as you did when you were more physically fit and younger. So the Lipo T, look for the red bottle, go to the website, lipodrops.com, and remember that today and today only, we have a special discounted coupon program that is for a certain percentage off. And if you are participating, 20% off using the code MJ for Men 20. MJ for Men 20, 20% off. And this is only going on until midnight tonight. So ladies, you can get this for the men in your life. It is perfectly compatible with virtually any other medication they can take. It should work just wonderfully with no problems, no real contraindications. You don't have to worry about that. So men, you can order it. Ladies, you can order it for the men in your life. They'll be glad that you did. You'll be glad that they did as well. So the Lipo Tea special, 20% off. Go to the Lipodrops website right now, lipodrops.com. Get that special because it's going to be absolutely incredible. This is the website right now. Nothing feels worse than hopeless and frustration, right, guys? That's what we're talking about. The lipodrops.com. Try Lipodrops. It is absolutely incredible product. I have to say that it is a part of my supplemental regimen. You've heard Dr. Collier talking about Dr. Collier's healthy trio. That's vitamin D, omega-3 fish oil, and probiotics, but also the Lipo Tea. And it's not sold in any stores, not available any other place at any other site. You can get your Lipo Tea right now and find out exactly how you can be the absolute best that you can be in the bedroom. Be the best that you can be in the bedroom. Okay, now, Havlick, thank you so much. Let's do our roll call. Who's logged on and where are you logged on from? Let's see. Okay, Sherry Gamble from Dallas, Texas. Hi, Sherry. It's a pleasure to see you. Calling in from Dallas. Sean, Big Time Green, my man. Sean, get some of them Lipo Teas, man. You need some. Makiba Bowling. Hi, Makiba. So good to see you, darling. Thank you for local Douglasville. Hi, Willette Carter. Good evening. It's so good to see you. You have become a regular. We appreciate you. Dorothy Gillum Brown. Good evening from Baton Rouge. Baton Rouge, one of my favorite cities. Keith from Jacksonville here. Thank you, Keith. Keith, get some of the Lipo Tea. C.L. Turner, hello from Baton Rouge as well. We got lots of followers in Baton Rouge. Connie Daniels Conright, good evening from Florida. Hi, Connie. Thank you for joining us. Patrick White, good evening, fam. Thank you so much. We appreciate you joining us, Patrick. Maurice in Chicago, get those Lipo Teas in Chi-Town, man. Tell all your friends about it. They'll be glad you did. Carr Brown, Gainesville, Florida. Thank you, Carr. Victoria Pleasant Wallace from Louisiana. Hi, Victoria. How you doing? Thank you so much. We appreciate you. Latoya Tucker Robinson from Miami, Florida. We got the East Coast and the South. Anybody from North, New Jersey, New York. Charles O'Neill from Shreveport, Louisiana, one of my favorite cities as well. Patrick White from Florida. Patrick, thank you so much for tuning in. All right, we got lots of people. Harriet Bastian from Florida. Hey, Harriet, we got Florida well represented this evening. That is so good. I'm so glad that you have decided to join us. Rosemary Green, good evening from St. Louis. Hi, Rosemary. Thank you for joining us this evening. I love St. Louis, one of my favorite cities. Now, let's get down to what we're here for, and that is to answer your healthcare questions. Let's do it. Again, we introduced the topic of men's sexual health. We're going to talk about women's sexual health as well, and I'm going to interject some sexual health anecdotes throughout, if we have any lovely questions. But if we got questions that will continue, we'll do it. Catrell Murray, why do vibration drops top blood number and increase heart rate to above 100? Okay, I'm not sure what that question means, Cantrell. Maybe expound upon it. Why do vibration drops top blood number and increase heart rate to over 100? I'm not sure what you mean by vibration. Do you mean physical vibration, or is there something else I'm not sure about it? Do you mean vibrators? I don't know. Let's clarify that question. We'll come back around to it. Havlick, let's do it. Hey, Harriet. I've been listening for a few months, but this is my first question. Thank you so much. I had a thyroidectomy a few years ago. For the past year or so, my TSH test results have been going up and down from one extreme to the other. Last week, my result was 0.14. What can I do to stabilize my TSH? I'm taking levothyroxine, 88 micrograms for 3 days and 100 micrograms for another 4 days. What can I do to stabilize my TSH? Harriet, one, get off of Synthroid, levothyroxine. There are other thyroid preparations. There's Nature Throid, there's Armor. Those are, Synthroid is just that. It's a synthetic thyroid hormone, and it is predominantly T4. T4 is inactive thyroid hormone. It has to be converted to T3, which is active thyroid hormone. And a lot of people do that very efficiently. Some people don't do it that well, but they do it. Others don't do it at all. So the numbers fluctuate in a variety of different ways. If you still having TSH numbers, I don't know whether you had a partial thyroidectomy or a complete thyroidectomy, but you're going to have to be on thyroid replacement, and you need to tell your endocrinologist or your primary care doctor, whoever's coordinating this, that you like to try another thyroid product. Nature Throid and Armor are T3 and T4 together. So regardless of how well you convert the T4 to T3, you have active T3 that's there. So it's just a more common sense product. It works better. You feel better on it. There are minimal fluctuations in your thyroid levels. So other things that can, of course, cause your thyroid to fluctuate: your level of hydration, the time of day that you take the pill, whether you're anxious, depressed, whether you're getting exercise or whether you are not getting exercise. All these things can make a difference in how your thyroid hormones respond and whether you have any innate natural thyroid function left in your body. But if you had a total thyroidectomy, then you have to have complete and total thyroid replacement. And I highly recommend that you talk to your provider about, so just Google the information so you'll go in empowered on Nature Thyroid or another thyroid product called Armour, ARMOUR, ARMOUR. And that's, once you start down that pipeline, it's going to give you a variety of different other pathways to go and get more information. So go in empowered and tell the doctor that you want to work with them, not, against, oftentimes you do that, they come in and say, oh no, you went to Dr. Google and, and I want to keep you on what you're on. A lot of doctors also are not familiar with it, really don't know how to use the other thyroid products. They were trained on Synthroid. Synthroid is the number one most prescribed thyroid replacement therapy. But I think it's not because of efficacy. I think it's because of marketing. I think it's been sold better, and that's what doctors were trained on. And doctors practice the way they were taught to practice, and their mentors taught them how to practice, and so on and so on. So looking at alternative thyroid therapies is something that they may or may not be familiar with. So, but again, share that information. But if you have a provider that's not willing to work with you, you need to change providers, because a chronic disease like thyroid requires a partnership between you and your physician provider that ultimately results in you having the best outcome that you can be. Not what they want to do necessarily, not what you want to do necessarily, but what needs to be done by both of you to get the best outcome. Great question. You get the question of the day for your first question. We appreciate you. Latoya Tucker Robinson. Also, how do you know if a loved one is experiencing early stages dementia or Alzheimer's, especially if the loved one is not willing to go to the doctor to get evaluated? Latoya, maybe you heard me this morning do my discussion on Wellness Wednesday on the Rickey Smiley Morning Show, and I talked about some of the signs and symptoms that you have to be concerned about. This is a simple matter of, forgetting where your car keys are, or forgetting why you walked into the room, or why did I go into the refrigerator? I forgot what I was looking for. Oh, what's the name of the person I'm talking to? And I know this person, or, a delay, and all of a sudden the person's name pops in your head, but they walked away at this point, but now you remember who it is. Those simple things can be due to a variety of different easily treatable conditions. The most common being sleep deprivation. If a person is not getting a minimum of 6 to 8 hours of sleep every night, we found that sleeping less than 4 hours, are amazingly and surprisingly enough, sleeping more than 10 hours has negative cognitive effect on you and causes early signs and symptoms of dementia. Now, if there are other neurological signs and symptoms, like the person is off balance, or they're falling, or they're complaining of being weak on one side or the other, they're having any speech problems, as in can't get their words out, forgetting their words, etc., or if there's a personality change, that requires immediate full evaluation by the doctor. But it's going to be difficult. There's no at-home test that you can get for Alzheimer's disease. As a matter of fact, it's not really an efficient medical test at the doctor's office. It's more the evaluation capabilities, experience, and expertise of the provider that will help make that diagnosis. But there is no dementia or Alzheimer's test. There's no blood test that you can get that's positive, although there is one being worked on. They found that there are some things that you can detect in the blood that are highly associated with Alzheimer's disease. So we're getting there, but this is a problem. You have to be passive aggressive and get that person, usually the man in your life, your father, your brother, your significant other. You got to be their health advocate. Tell them it's only for them. You've noticed a few things and that they need to have a comprehensive physical examination, or just say you need to get a comprehensive physical, which everybody does. And during that physical, that question, concern can be asked, and then we can start an early evaluation. Thank you, Latoya. We appreciate you. Angela Smith. I'm a 58-year-old woman who wants to know what is good for memory loss. I wish I could recommend the multitude of products that you hear advertised on radio and television all the time. There's been no clinical trials or studies that confirm any of them have any benefit at all. So what I do recommend are the things that we do know will give you benefit. Vitamin D, the body's natural anti-inflammatory. Most health conditions in the body are inflammatory conditions. So if you use an anti-inflammatory, you treat that symptom and stop that disease process from manifesting itself. So anti-inflammatories, omega-3 fish oil, good for nerve repair, nerve healing, and good brain function. So those two things are the things that I would start off with. Good healthy nutrition, making sure that you're getting enough rest, all of those things, and then mental exercises, word games like Sudoku, that numbers game, which doesn't require you to like math or be good at math. It is just a thinking game that requires you to do that. Oftentimes, stimulating adult conversation and reading also. I like to read the newspaper every day from cover to cover. And just a few weeks ago, my newspaper announced they're not going to have hard editions anymore, mailed except on the weekends. So I can go on my iPad and read it, but that's not the way I like to do it. I like to read paper in my hand. And so now I'm looking for other ways to stimulate, including, of course, books and novels and things that interest you. But anything that requires you to think and get through. And it can be something pleasurable, like reading a book that you like to read. It doesn't have to be, a really deep book. It can be a romance novel, anything that you find pleasurable, but just make it a regular part of your routine. And stimulating conversation, not just inane conversation. You don't want to just talk about the housewives. You also don't want to necessarily talk about politics or religion, but a stimulating conversation with someone and on a regular basis can also help keep your brain functioning on multiple levels. So that is a process that requires continuous attention. But remember, the simple things like the supplements, the vitamin D and omega-3 fish oil, which are available on the Lipodrops.com website. And you can use our discount coupon on those products as well, not just the Lipo Tea. Up until midnight tonight, you can get some things that will help you. And there's no magic in a bottle. You're not going to take a pill today and tomorrow, all of a sudden, everything is great. That's not the way it's going to happen. But over time, a few weeks, six weeks at the most, probably closer to 2 to 4 weeks, you'll notice improvement because you're going to have those brain tissues restoring and repairing themselves, particularly if you add some of the other things that I talked about in reference to stimulating your mind. Okay, great question, Angela. Tamisha Crowder, what can I supplement if I'm not able to hold down fruits, salads, and vegetables in a raw form? I vomit each time I swallow. Okay, Tamisha, something else is going on. You may have an obstructive lesion. You may have dysphagia. Something may be going on with your esophagus. Digestion starts in the mouth, and you should actually chew each portion and serving of food 15 times before you swallow. So oftentimes the portions that we have are far too big and we rush through it. We chomp it down and swallow it as quickly as we can. And that is not the efficient way to digest food. So you need to get smaller bites, more time between bites, making sure that your mouth is wet enough so the saliva can make a decent wet bolus for your food to slide down easily. But if there's some obstructive lesion that needs to be looked at, so make sure that you evaluate that. You need to be under care of a doctor. You need to have had an upper endoscopy if you haven't had one already, to look down your throat to make sure nothing else is going on, because vomiting each time you're swallowing does damage to your esophagus, does damage to your teeth and your mouth, and creates health problems because you're not getting nutrition. So this needs to be evaluated. You need a thorough, comprehensive physical examination, 1, 2, evaluation by a gastroenterologist and stomach specialist. And they're probably going to ultimately have to look down in your throat to see what's going on down in there. Great question, Tamisha. Please keep us informed as to how you progress. So remember, the Lipo Tea product, hold on with Craig's question, the Lipo Tea product is now available. We have talked about it this entire year. So up to this point, because it has been available locally, but not on the Lipodrops website. So the Lipo Tea, this is for men. Men, this is a product that you take every day to enhance male function. Not only it does so many other things. You will sleep better, you will eat better, you will feel better about yourself. So things that you can't necessarily measure, but your ability to function, your sexual function, will be markedly improved with this product, and we highly recommend that you try it. I have my patients that take this. Some still supplement with PDE5 inhibitors. Some supplement as well with testosterone replacement, but this product will give you the benefit that you like. This is a product that locally is just legendary at this point. And when people see me out in public, they will ask me and my male friends and patients, do you have any? Did you bring any? Can you get some? When I go to places like the barber shop, I have to have it readily available. There are 12 chairs in my barber shop, and every barber in there likes to use this product. So it's available, and now you can get it. And we have a special going on right now where you can get a major discount by using this discount code. You get 20% off of Lipodrops using the code MJ4Men20, MJ4Men20, and you go, and that's going to be good till midnight tonight. And you can do that. You can use that for any of our products, but for the Lipo T in particular, this is our launch. It's available, but it's in limited quality, so get it now, because we're going to be like a lot of other products, we won't be able to manufacture it fast enough to meet the demand, because now that it's out there and available, people are going to be wanting it. And once you tell people about it, you tell your friends about it, they're going to be wanting it. So please, the Lipo T from the Lipodrops company, go to lipodrops.com. Lipo T, men's enhancement formula. Okay, thank you. Now, next question, Evelyn. Okay, Craig Brown. Thank you, Craig. I appreciate that. I have a rash in my inner thighs, trying to figure out what it is. The most common rash in the inner thighs is jock itch. It's a fungal infection caused by skin-to-skin contact. If your thighs are rubbing together, and if this picture of you is real, then you probably don't have that problem. But if you do, it can also be a contact dermatitis from just that friction. But the most common thing where you have skin-to-skin contact is a rash caused by a fungus. That fungus needs to be treated. There are topical treatments that are available, antifungal creams and powders. The most common is chlorotrimazole. It's available over the counter. You can actually get it at the store where everything is now $1.25. You can get it there, and it's the exact same product. It's going to cost you $20 or $30 in a traditional drugstore. It's just a generic brown package that says antifungal on it, and it works wonderfully. It's good for a jock itch. It keeps your toenails from getting fungal. It stops you if you have athlete's feet. It's good for any type of fungal rash. So try that. Even if it is not a fungus, because of the medication, it will calm down the irritation and give you some relief. But if it does not totally, completely resolve it in 10 days, then something else is going on that needs to be evaluated. Also, wearing boxer style briefs that keep your testicles and your inner thighs separated so there's not skin to skin contact. A lot of men like to go commando. They don't wear underwear. And when they do that, they always have this problem because you get sweaty down there. And particularly if you shave and remove the hair from that area. The hair, the genital hair, the hair under your arm serves a purpose. The purpose of it is to perform a barrier so that air can circulate it and dry the sweat and the moisture that's there under normal circumstances. So if you have hair under your arms, that serves a purpose, and hair in your genital region, your genital hair, your pubic hair, that serves a function. But oftentimes now, men will shave to the totally clean. Women will shave until they're totally clean down there, and that makes them more susceptible to yeast infections for women and jock itch for men. Same or similar fungal type infections. The other thing you can do, again, you wear boxer style briefs. They don't have to be tight, but just tight enough so that they separate the testicular sac from the inner upper thighs. And you can take your underwear, turn them inside out, sprinkle some antifungal powder in there, turn them right side in, put them back on. And that'd be something like Gold Bond. Once you no longer have the infection, something like Gold Bond is excellent because you want to prevent yourself from getting the infection again, because it is a chronic thing. If you are susceptible, it will recur the next time you get sweaty. If you go to the gym and work out, you need to change clothes, shower, dry that area thoroughly. Even if you have to take a blow dryer in that area, if they have one in there. If not, make sure you take a towel, because we will gently dry in that area, and we're very moist even when we get redressed, and you'll find that makes you susceptible to those types of infections. Same thing with your feet. So make sure that you wash and dry your feet thoroughly, particularly between the toes. And you can take your socks, turn them inside out, put some antifungal powder inside the sock, turn it right side in, put it on, and that will help cut down on these type of problems. You can do it with footies. You can do it with regular socks. You can do it with any type of socks. If you have the problem under your arms, you can take a t-shirt, turn it inside out, sprinkle the antifungal powder in the under the arm portion of the shirt, put the shirt on, and then not only will that stop you from getting a fungal infection, it will also stop your white t-shirts from getting yellow stains from deodorant. I actually read about that in the men's magazine and found that it works wonderfully. So you turn your t-shirt inside and out, you spray the antifungal powder there. It stops the deodorant from turning those t-shirts yellow in the underarm area, so that your t-shirts remain fresh and crisp, and you look, fresh and crisp. You don't have to replace those t-shirts because you can't wash that. Once it's there, I don't care how much bleach you use, what type of washing powder you use, it's not going to remove that. And so the only option is to get new t-shirts, which can be very expensive in this day and age. But if you do that one simple thing, you won't have that problem. You'll find. And in particular with some of these dry weave products now that they have that breathe, and versus 100% cotton shirt, those are much better for areas where you have skin on skin contact, and you'll find you get a great benefit from it. Craig, great question, sir. Mel Williams, I have Lipodrops and just want to make sure you're using them correctly. Mel, and I'm so glad you made that point, because I had patients that have used the Lipodrops and they're not using them correctly. Ideally, you want to use it before your meals, at least 15 minutes before your meals, because what the Lipodrops do is alter the way that your body metabolizes the food that you're eating. Now, if that's difficult to do, I have people that wake up in the morning and they put the Lipodrops under their tongue almost immediately, and they may not eat for another couple of hours. Now, there will still be benefit from the Lipodrops. If you take it 15 minutes before eating, it's going to be a much better benefit. And you can take it once a day before one meal, preferably your largest meal of the day, or you can do it up to 3 times per day before each of your meals, breakfast, lunch, and dinner, and you will get a greater response. Originally, we were just advocating using it for having success. They figured if they use it once a day, then using it twice a day or 3 times per day would be better. And I did not agree with that at first, but I could not argue with success. Then we did a clinical trial and found out that, yes, you do get greater benefit. It's actually how we came up with the Lipodrops Max formulation, because it's 10 times more potent than the original Lipodrops formulation, and you get a better response. And so because these are all natural products, you can't get too much of them. They're also compatible, again, with most disease states, so high blood pressure, diabetes, high cholesterol. You can use Lipodrops in each of those. No problem, no issues. If you have allergies to fish, it doesn't matter. There's no fish oil products in there. You can take it in those circumstances. Even individuals with thyroid disease, you can use the Lipodrops, and they will help you to obtain your weight loss goal. So as we go on your weight loss journey, use the Lipodrops once, twice, or up to 3 times per day, at least 15 minutes before your meals. But even if you use it right before you eat, you're going to get a greater benefit than just doing it on an empty stomach and not eating, because the whole point of the Lipodrops is to alter the way that your body metabolizes food. So if those two things are not connected, you're not going to get as great a response as you would if you were taking it 15 minutes before your meals. So that is the ideal way to do it. And I think you'll see a major difference in response and how you get your response when you do that. Also, again, you need to add to that either the 8-hour per day intermittent fasting program. And if you got the Lipodrops, then it comes with a diet plan. A lot of people don't even open the box and look at the diet plan. They just take the drops out, and there's a piece of paper folded in there that has the diet plan in it that tells you how to eat, when to eat, what to eat, etc. Make sure that you follow those guidelines. That's included as a bonus when you use the Lipodrops, and it optimizes how your body metabolizes the food that you do eat, and so you will ultimately result in great weight loss. Great question. Carmen Davis, Carmen from Cleveland, Ohio. Great, Carmen. I'm on Mounjaro 10.5, my 3rd week so far. My total weight loss is currently 20 pounds. Can I take the Lipodrops as well? Absolutely, Carmen. The Mounjaro is a class of drug called a GLP-1 inhibitor. GLP-1, the most common one and the most that everybody's most familiar with is Ozempic. Ozempic is the exact same product as a drug called Wegovy, manufactured by the same company. It just, if it goes to the right, it's called Ozempic, and it's, quote, used for diabetics. If it goes to the left, it's called Wegovy, and it's used for weight loss. It's the exact same drug manufactured by the exact same people. Now, Mounjaro is the next generation of that product. I think it is a superior product because it blocks you at 2 sites, not just one. Very effective and causes dramatic weight loss. I have patients that are using both, of course, in my weight loss facility. We use semaglutide, which is the primary generic name for the product. And we also use Lipodrops in addition to the Keto Max. So I tell people weight loss is a combination of things. How much you want to lose, one. Number two, how quickly you like to lose it, how much you need to lose versus how much you want to lose. I have people that come in and they're at great weights, yet they tell me they want to lose 30 pounds. And I say, you don't have 30 pounds to lose. Where are you going to lose it from? So I said, it's not what I say, even if you did it and it can be done, I say, we could get the weight off of you. That's not the problem. The problem is, one, having an obtainable weight loss versus a sustainable weight loss. We can get you to almost any number that you like. If you think that that's where you want to be, that's not what Dr. Collier recommends. That's why a medically supervised weight loss program is so important, because people sometimes, they want to be at the high school weights. And when you're a mature adult, that's just not a good weight for you. But more importantly, you can't possibly sustain it. Your body will fight you the entire time. You will probably also go from looking good and looking slim to looking sick almost, being too thin. And that is a phenomenon. But some people, they get hooked on the idea of looking thin, and they like the way they look, and they want to be thinner and thinner and thinner. So we have to monitor that. But the answer to your question, Carmen, is yes. We oftentimes will combine the Lipodrops with those injectable weight loss medications, the semaglutide, the Ozempic, Wegovy, and Mounjaro. All great products. Again, I think of the three that are available, Mounjaro is a superior product, but they all are good and they all work. So depending upon your availability for it, Mounjaro and Ozempic are medications that you have to have a diagnosis of diabetes to get, unless you get it some of the other places that people are making it available, like weight loss clinics, where people are getting it. But again, your insurance will not cover it under those circumstances. The cost of these medications can be exorbitant. It can be up to $1,600. That's $1,600 for a 30-day supply if your insurance doesn't cover it. If you have a diagnosis of diabetes, then your insurance will probably cover it, but you have to have your doctor order it for you. It has to be a prescription. And so you have to work with your primary care provider or your endocrinologist to calculate that medication. But I'm glad you mentioned Mounjaro. It's a phenomenal product. And again, I think it's the next generation of weight loss medications, and all of these drugs will soon have the weight loss indication. Mounjaro, again, is only indicated for diabetes, but everybody knows it makes you lose weight. And if you're not diabetic, you take it, you lose weight. If you're diabetic, you take it, you lose weight. But you also get control of your blood sugar, and it lowers your hemoglobin A1C in a phenomenal fashion. These are the biggest breakthrough, this class of drug, in the treatment of diabetes in my medical lifetime. And it's going to change the diabetes as we know it, because people will be able to take these medications, not only lose weight, but also control their blood sugars and be in much better shape, with decreasing their cardiovascular risk, no heart attacks, no strokes, no kidney disease. And that's much better outcomes than individuals who are using some of the other older medications, including insulin. Insulin keeps your blood sugar controlled, but insulin makes you gain weight. The number one side effect of insulin is weight gain. So it is a big problem. We tell you not to eat, but we give you insulin, which makes you want to eat. So it's kind of a catch-22 situation there. But great product, Carmen. Thank you for bringing that up. But you can take the Lipodrops, and I recommend that you do if you want to lose more weight quickly. Okay, that's me. My father-in-law has stage 4 prostate cancer and it has spread to his bones. They gave him medicine and told him to keep moving. What can he do to keep his bones from breaking? Okay, very good question, a complicated question. But because he has stage 4 prostate that has metastasized to his bones, and that's basically how you make the diagnosis of stage 4, it spreads to other areas. And the damage they can do to the bones, it can cause weakening of the bones, bone compression fractures in your back, just excruciating pain wherever it has metastasized to. The most common area is the back and the hip, but it can be anywhere, your bones, your legs, your arms, anyways. So one, you want to keep your bones as strong and healthy as possible. And one of the primary therapies for that is vitamin D therapy. As soon as a person is diagnosed with any type of cancer, they start you on vitamin D. So you need to be on the vitamin D at a treatment regimen that's going to actually improve your cancer situation as well as strengthen your bones. That dose would be 5,000 international units per day. Vitamin D is available. I've seen it in as little as 200. That is a total and complete waste of money. It doesn't do anything for you. So it has to be at a therapeutic dose. Commonly now 1,000 milligrams are international units. It's not milligrams. The unit of measure is international units. And so 1,000, even 2,000 has become more common. You can get 5,000, but our Doctor's D product is 5,000 international units per day. I promise you, if you get in the Doctor's D, 5,000 international units of pure vitamin D, that's going to improve everything. It's going to prolong his life. It's going to help keep his bones strong and keep him around. Stage 4 is still treatable, and people still do come back from it. There are other things. He's probably going to need chemotherapy, probably going to need radiation as well as part of his treatment regimen. Those two things still good, but vitamin D is great. It's a great natural way to do this. And there are some other targeted biological. They can actually take the cancer cells, create antibodies to the cancer cells that will fight the cancer cells in a more natural way versus chemotherapy or radiation for that matter. That's just that biological therapy is the latest and greatest for cancer. It is available. You just have to go to a place that it is available. If it's not available in a place that you are, doctors are going to be reluctant to mention it because that's not how they treat people. Doctors treat patients with the way they were trained and what's available to them. So if there's a new great phenomenal treatment that they either haven't been trained on, don't know about, or don't have access to, then the chances are they're not going to recommend it as likely as if it was readily available. So you have to be, when you have a cancer diagnosis, this is one of the times that Dr. Collier will tell you, you do need to go to the internet. You do need to get as much information that is available and find out about some of these new targeted therapies that are biology-based, biologics, if you will, and find out about new ways that they're using to treat cancer that are having phenomenal outcomes. But it may require travel. It may require him to go somewhere that is readily available. One thing that I can say now is a lot of these treatments that were only, like at the Cleveland Clinic or the Sloan Kettering or whatever, are much more readily available now because one, pharmaceutical companies are creating these products, and two, doctors, this generation of physicians are being trained as they come through their residency programs about these newer therapies. And so this is a situation where you might need to have a more recently graduated physician that's more up to date on some of the current therapies versus someone who's been in practice, say, for a longer time, who may not be aware or just may not have it in their armamentarium. So again, that's not always the case. Some doctors stay up on everything and continuously educate themselves and continuously update their skills and know about everything that's readily available. Others, it's human nature. You learn how to do something one way. I've heard of Dr. Seven. Why would I do that? I've done it this way for 30 years and it works wonderfully for me. I said, oh my God, you've done it the same way for 30 years and you're proud of that. Yeah, no, you don't want to do that because things have changed. Sometimes, you actually have to go along if there's something newer and better available. Learn how to do those things. And if you don't want to do it, make it available to your patient by referring them to somebody who does. Okay, great question. Good luck with him. Keep us informed as to how he does. Mary Hollingworth, I've been taking care of elderly clients. I need a good fiber product. Just had third and final hemorrhoid clipping after colonoscopy. All right, Mary, guess what? Our Lipo Cleanse is the perfect product. It is a fiber supplement that results in large, easy to pass bowel movements. Large, easy to pass bowel movements. You can take as few as one a day, as many as 4, depending upon how you respond to it. The key thing is crunchy fruits and vegetables, a fiber supplement such as our Lipo Cleanse, and hydration. You have to stay hydrated because if the lining of the colon gets dry and it's not mucus filled, then it's very difficult for the stool to move through the length of the large intestines. The large intestines starts on the right side of your body. Your stool has to move up against gravity. at about the level of your belly button. It has to turn 90 degrees and come all the way across. During that time, the function of the large intestines is to absorb fluid, reabsorb fluid. So when that happens, when you're looking at the reabsorption of fluid, you want to make sure that you're getting that stool out of there as quickly as possible, not letting it sit there and soak up and get drier and harder as it's trying to move through the intestines. As it moves through what's called, it starts off on the right side, the ascending colon. Then at the level of the belly button, it goes across called the transverse colon. There again has to turn 90 degrees. Now it's coming down called the descending colon. And the entire function, the large intestine, the reabsorption of fluid. So as it moves, it goes from being completely liquid on the right side, like when you have diarrhea, to becoming drier and harder as it moves through as a natural process. But if you don't eliminate, when you get the urge to eliminate, and that means the urge to have a bowel movement, and I know you ladies, you hate to have a bowel movement outside the comfort of your home. So make sure that when you get the urge to go, you go. But that means carrying around Clorox wipes or whatever you have to do. Do not wait. Do not hold it. Get it out of there as quickly as possible, and that will give you good bowel health. But a good fiber product, to answer your question, Mary, is our Lipo Cleanse product. Lipo Cleanse product. You can take as few as one a day, as many as four. When people take 4, I tell them to take 2 in the morning, 2 in the evening, with a full glass of water, not just a sip to get it down, and that will get you going. But it is not a laxative, so you don't get uncontrolled bowel movements that are loose and squirty and can give you a sense of urgency. What this does do is when it's time for you to go, you'll be shocked and surprised at how large your stools will be, and you'll be like, wow, did all of that come out of me? Because that's what you carry around all the time. And when you get a good product like our Lipo Cleanse, instead of you carrying it around, it moves it out. It keeps your stomach flat, stops you from having indigestion, acid reflux, all kind of other GI issues, because your stomach and your gastrointestinal system is one long tube, one long space. Starts off with your mouth, your esophagus, your stomach, your small intestines, large intestines, sigmoid colon, and rectum. That is from the mouth to the anus. That is how the name changes to protect the innocent, but it is still one space. In that space, if you get obstruction or blockage at any point, everything backs up. And you know what it feels like when that happens, because it has happened to all of us. You start to burp, your food won't go down, you get indigestion. And, it's a bad feeling. So you need to keep that pathway clear, and you want to keep food products going in, going down, and through. Because if it doesn't go down and through, it stops. And it can stop, and it can actually even start what's called reverse peristalsis and start to come back the other way. And you really don't want to have that happen. That really can be a problem. So Lipo Cleanse, great product, great opportunity for you to do good for your clients. Great question. Anthony Allen. Hey, do I have a final question? What can I take to put more lead in the pencil? Will Lipo T help? That is exactly what the Lipo T does. Anthony, you have, in addition to helping with your libido, your desire to have intercourse, it puts more lead in your pencil. It ultimately results in you having longer and harder erections and able to function in erections on demand, which is kind of where you want to be. As you were years ago when you were young and functioning and the wind blowed, or you had the right thoughts in your mind and get an erection. Sometimes, unfortunately, in other situations where you didn't need to have an erection, they use at the table, you can't stand up because you have a spontaneous erection. Well, you're going to have, hopefully it won't be that bad, but if it is, that's not necessarily a bad thing. But the Lipo T puts more lead in your pencil, improves your overall sexual desire, your libido goes up, but more importantly, your ability to function goes up. Nothing more frustrating than the desire to have sex, but the inability to have sex. So this is a twofer. This is a twofer that stops that from you. You have an increased desire, but also an enhanced ability to function sexually. And I'm telling you, the Lipo T is a great product. I personally utilize it as one of my supplements, and I think that I'm glad that I do. I'm glad that I do. Thank you. Great question, Anthony. Okay, so one more time, I just want you to see this bottle, this red magical bottle. This is what's going to be life-changing for the men in your life, ladies, and for the ladies. Get this for the men in your life. Men, get this for the ladies in your life. We got that special discount coupon going on right now, 20% off Go to lipodrops.com right now and order. Use the code MJ4Men20. MJ4Men20. Get your Lipo T. This will be life-changing. I'm so glad that we have finally made this available on the website. It was kind of a product that everybody knew about, but people were having difficulty getting it. People were calling my office trying to get it. We're trying to practice medicine, yet ship this product out to people from my office. Now you're going to be able to get it on the Lipodrops website easily. Lipodrops.com. Get your Lipo T. Change your life, man. Change your life. Okay. Next question. Okay, Velma Austin, why should you avoid carbs for the last meal of the day? I'm not necessarily sure that I agree with that philosophy. It depends on what time your last meal of the day is. I actually found that carbs enhance my sleep. If I have a carb meal like spaghetti or pasta or even rice, I sleep better. I sleep better. So I don't necessarily block that. What I don't recommend is that you eat carbs at 10 o'clock at night and go to bed at 10:30 or 11, because then it's going to, because the amount of calories in carbs and your body's metabolism slows down, your body's going to convert that into fat, and then you're going to have a greater fat content in your body composition will have a higher fat percentage. So when you do that, you're sedentary. But if you're having an early meal, 5 or 6 p.m., and you're going to be up for at least another 3 hours, I don't think it's going to necessarily make a difference as far as your overall weight loss, weight sustainment, or body fat composition. So I'm not necessarily an advocate of that philosophy. I understand the essence of your question. But again, I think that what's more important is that you don't eat anything, or that you have, more importantly, finished eating everything that you're going to eat, whatever that is, at least 3 hours before it's time for you to go to bed. At least 3 hours. So that means start your dinner, say at 5:30, 6 o'clock, be finished by 8. Most people go to bed about 10:30, 11 o'clock. Universal wake up time is 6. So most people can, if they follow those guidelines, get at least 7 hours of sleep a night, and they'll be good, hence, and feel rested the next day. Okay, Dr. Kai, you need some water. Okay, Hallie, we're good. Lois Bridgewater Door. Hi, Lois, or Louise. I'm texting from Louisiana. What type of problem could I have if I get headaches at night while sleeping almost every night, if that goes away when I get up in the morning? The headache is behind my eyes, but deep in my head, it feels like pressure. I had an MRI done. It was normal. I had my sinuses and eyes checked, and nothing was found. I know that it's not a typical symptom people have who have migraines. And so it is not a migraine. I think it is related to sinus and atmospheric pressure. The bariatric pressure is what's getting you. When you lay down at night, your sinuses are becoming a closed space, and pressure is building up from outside. Whenever you have a fluid-filled space, like your sinuses, you have sinuses above. These are called the frontal sinuses above your eyes. Below the eyes, that's the maxillary sinus, but straight behind the bridge of your nose, between your eyes, is called the sphenoid sinus. And that is the space that it sounds like you're having the most problem with. You might actually benefit from using something like a nasal lavage machine, taking a mucolytic like Mucinex DM maximum strength to make the mucus thin and watery so it doesn't plug and cause a pressure allowing to build up. It's not bad if you have the mucus, blow your nose, clear it out, etc. But as long as the mucus is thin and watery, it won't form a balloon-like barrier and give you that increased pressure. A simple way to check that diagnosis, and there's nothing necessarily that would show up on the MRI, which is why it was negative. MRIs are looking for venous arterial malformations, aneurysms, and tumors. If there's none of those things, quote, it's negative. Doesn't mean there's not a problem in the plumbing, and this is a plumbing problem. It just needs to be simple solution. Do you have this problem if you sleep sitting up? Because then there's no pressure, because your sinuses are draining down your throat, and there's no ability to do that. If you're laying down and you find that you have this problem, that confirms in a very simple way that it's just that. And the treatment options would include a nasal lavage or saline wash. You can buy a bottle of saline wash for $1, but you can get a nice nasal lavage machine for maybe $40, $50. You hear the commercials all the time. I understand that those are amazing for people with sinus issues. A steroid nasal spray like Flonase a non-sedating antihistamine like Allegra, Zylol, Claritin, or Zyrtec. These are all part of the treatment options. So the non-sedating antihistamine, the nasal sprays like Flonase or Nasacort, the mucolytic like Mucinex DM maximum strength. Those things, something you may end up having to take every day for the duration to prevent that from happening, but it will give you relief and you will be able to sleep without having the headache. So let's try those options. Get back with us and let us know in a couple of weeks how you responded to that therapy. But again, a simple test on the night when you don't necessarily have to get up the next day because you don't want to have daytime sleepiness. Try sleeping sitting up, even if it's just propping up. I like to put 2 pillows, then 1 pillow, so it's almost like a wedge. There are literally bed wedges that you can purchase, or if you have an adjustable bed, just let it up to about 30 to 45 degrees and see how you feel and whether you get the headache. If that relieves it spontaneously, that answers the question that it is strictly a plumbing phenomenon, and that all you have to do is keep the plumbing flowing, and that no problem. But I found that combination of treatment options, the antihistamine, the mucolytic, the nasal spray, results in symptomatic relief in the vast majority of people. It's rare that this becomes a surgical problem. It can be a surgical problem. I don't want to dismiss that option. Sometimes you have to kind of go in there and roll the rule. You may have a nasal polyp that's blocking when you lay down and creating that pressure phenomenon. And there's an in-office nasal surgery that you can get where they just stick a scope in there, just like doing a colonoscopy. They just see the polyp, flip it out, burn it, or tie it off or whatever it takes so that it doesn't bleed, and you have instant relief from that. So a nasal scope is something that most ENT specialists can do in their offices now to see if there's anything going on like that. But again, you don't have to go through any of that. Just do what I said about sleeping at about 30 to 45 degree angle elevated. See if that gives you some relief. Add that treatment regimen, the non-sedating antihistamine, the nasal spray, the mucolytic, the Mucinex DM, and see if that gives you relief. And again, don't expect one day for this to be fixed. If all of that works, you're probably going to have to be on it or something like it for the duration to give you symptomatic relief. Okay, next question. And final question. Lottie dread. So many black men going to dialysis. Hell, you know why black men are going to dialysis? Number 1 cause, uncontrolled high blood pressure. Number 2 cause, uncontrolled diabetes. Number 3 cause, high blood pressure and diabetes combined, resulting in hypertensive nephropathy, which is kidney damage due to uncontrolled high blood pressure, or diabetic nephropathy, which is where the diabetes, the sugar, the extra sugar in the blood does damage to the kidneys on the cellular level. The kidneys are basically a very fine filtration system that on the cellular level, if you have excess sugar, that sugar becomes like sandpaper inside those tiny, tiny capillaries, and they start to scrape and do damage. And as they heal themselves, they scar, they can't do what they're supposed to do, filter, because now they're thicker than the one cell layer that they should be to perform this function. So how do you control that? How do you treat it? How do you help it? You control the blood pressure, you control the blood sugar. You don't wait until you have kidney damage. You control those things. Fortunately, those medications that I mentioned earlier, the SGLT2 inhibitors, have been amazing as far as helping with kidney damage and heart damage. So cardiovascular benefits and benefits to the kidneys. Even in people that aren't diabetic now, they're using this class of drugs to help with kidney damage and kidney function. But there's so many people that walk around with CKD or chronic kidney disease, don't even know it until they do. When you go to the doctor, I talked about this last time on the Rickey Smiley Morning Show. Ask for a P test. Tell them you want a urinalysis. Don't say, well, I can't get a specimen because doctors don't want to handle P, so they're not going to ask you about it necessarily. So you go in anticipating as a part of your comprehensive physical exam, you want a urinalysis to evaluate your kidney function to see. That's the first step. That's the first step. And if there's the combination of a urinalysis with a protein greater than 30 milligrams, it should be no protein in your urine. Up to 15 milligrams is acceptable. You can live with that, and that can be due to a variety of benign reasons. But if your protein in your kidneys is 30 milligrams per deciliter or higher, there's damage to the kidneys on the cellular level, and that is the first stages. And the blood test will reveal your blood urea nitrogen, your creatinine level, and your glomerular filtration rate, or GFR, the most important blood test that you can have to evaluate your kidney function. So there we go. We get those things handled. We keep these African American men off of dialysis. Anybody on dialysis, it is so damaging for the family structure because a person on dialysis basically goes to dialysis. That's what they do. It takes so many people out of the workforce, particularly if you're the man and you're the breadwinner, and now you have to go to dialysis 3 times per week. Some jobs cooperate with that. Some people go to dialysis during the daytime and they work at night. Some dialysis clinics run 24/7. They run literally 24/7 to help accommodate people in the workforce. The problem is that when you get dialysis, you don't feel like working. And the next day you feel better and okay, but then the next day it's time to get dialysis again. So you don't feel good about it. The way to relieve that, of course, is a kidney transplant. And but the primary way is never get to that point. Keep your blood sugar controlled. Keep your blood pressure controlled. Don't result in diabetic or hypertensive kidney disease, and stay healthy. This brings to an end this episode of the Your Health is Important Facebook Live radio broadcast. We are so proud that you joined us today. We are so glad that you were here, and we hope that you have found this interesting. We hope that you have enjoyed it. We hope that we answered your questions. Listen to me on the Rickey Smiley Morning Show. We do Wellness Wednesdays on at 8:20 Eastern Standard Time each and every week, 8:20, where you have the opportunity to call in and ask your healthcare questions. Call us, tell us you heard me on the Facebook Live, and you got another question that you'd like to ask. Of course, you can reach us through the Lipodrops.com website, and I'm on all social media at Ask Dr. MJ. Go to the website, get your Lipodrops, get your Lipo Tea, your Lipo Tea special. We got 20% off Lipo Tea, 20% off tonight until midnight. Because you've heard this broadcast, our special code MJ for Men 20, MJ for Men 20 for 20% off of this amazing product that will be life changing. Thank you for a great evening. Thank you, Havoc, for your production capabilities. We appreciate you. And that closes the show. See you next time.